Hello and welcome. We are very excited today. My name is Elizabeth Faust. I'm a nurse practitioner and vice president of the American Professional Wound Care Association. I have the honor of interviewing three amazing clinicians today who have helped publish the article for this month's Advances in Skin and Wound Care. So I am pleased to be joined with Elizabeth Aiello, Dr. Jenny Prentice, and Laurent Chabal. Welcome, everybody.
Thank you.
Thank you.
I hope I said that right. Laurent Chabal, am I saying that right? Okay, good. So I'm going to ask that you first just give yourself a little bit of an introduction about who you are, and where you work and how you got started on this project. So I'm going to ask Elizabeth, do you want to tell us a little bit about yourself first?
Well, thank you very much, Liz, for the invitation for our group to be on this podcast. We are really delighted that the June issue 2021 has our CEU article on the International Ostomy Guideline. So you can download it from the website for the journal. I'm Elizabeth Aiello. I'm a nurse from New York City. I am board certified as a wound care nurse from WCET. I am the current president of the World Council of Enterostomal Therapists. And I am also a former board of director for DAPWCA and the past president of the NPIAP. So thank you for having us. And I will let the two other members of WCET who were part of the development team for this IOG introduce themselves.
Dr. Prentice, do you want to go next?
Thank you, Liz, and good evening, Elizabeth and Laurent and everybody else. I'm a nurse specialist in wound, skin and ostomy care, and I've been in this field since the early 1980s. I commenced in New Zealand, and now I'm working here in Australia. I am a founding member of Wounds Australia, founding editor of Wound Practice and Research going back to 1993, and I'm very privileged to be the current editor of the World Council of Enterostomal Therapy journal. I currently work primarily in aged care, but also community and often in the acute care sector as well. So lovely to be with everybody this evening. Thank you.
Thank you. I appreciate it. All right. And Laurent?
So thank you very much for the invitation. I'm Laurent Chabal from the French-speaking part of Switzerland. And I will do that in English, not in French, to be honest. So you can be relaxed. I'm a stoma nurse since 2003, involved in the WCET since 2004. I'm actually the president-elect of WCET, and I'm the privileged to have worked with Elizabeth Aiello and Dr. Prentice with this huge amount of work we have done around the IOG. I'm also, I have two jobs. I'm a stoma nurse on one part, and I'm a lecturer at university on the same time. So I try to manage the two works, and WCET is also a lot of work, as you can imagine.
Great. Well, thank you guys so much for spending some time with me this morning. We're going to be talking about the main article. It's practice implications from the WCET International Ostomy Guideline from 2020. And so I first just want to ask you guys, how did this project come about? Like, how did this form, and how long ago did it form?
Well, since I was involved from the beginning of the project, let me start, and then my colleagues can add some more comments. So WCET has been around for 40 years, and our mission is really educating nurses so that they have the specialized knowledge to take care of patients that have wound, ostomy, or continence care needs. And our members are in over 65 countries. And all of us identified that there truly was a need for an international guideline that was really applicable for patients, regardless of what country they lived in. So having universal principles that could be adapted to their specific country was really deemed to be important. So for example, any person who has an ostomy needs to have a way to collect the exudate, whether it's urine or the stool, coming from their stoma. So in different countries, there will be specific products that will be available, some of which are commercially developed by industry partners, and in other countries where they have to improvise equipment because pouches may not be available, they're going to use creativity or indigenous materials that might be from plants, for example. So how the stool or urine would be collected from the ostomy might be different, but the principle of protecting the stoma and the peristomal skin are universal. And that's one of the deficits we found, that many of the guidelines really didn't address how people in countries that didn't have the abundance of resources could apply them to their patient care.
No, for sure. I mean, coming from a U.S. perspective, when I read the guidelines, it seemed a bit of common sense. But, you know, certainly when you're including that volume of countries and cultures and different practices that are not, you know, as universal, even across the United States, it's not as universal as it should be. And so, you know, do you think that including that many countries and cultures helped with your guidelines, or did it hinder it, or how did that play out in like the workflow of being able to say, yes, internationally, this is best practice and this is what we should be doing for our patients and for our providers?
Thank you, Liz. Firstly, and primarily, I think having the contributions that we did receive from the international delegates was enormously helpful. It helped us to provide a very holistic view of the many and diverse cultures that are found around the world, and in particular, how ostomies are perceived by different cultures and different peoples, and within different socio-economic groups, and by individuals who have their stomas and their close family and friends. So giving member IDs the opportunities to discuss ostomy care from their own cultural perspective also assists people from other countries, but also people within their own countries, how to manage the person with a stoma, both culturally and clinically.
And if I can, I'm so sorry to interrupt you, but you had 22 different countries weigh in on this, is that right? So you have members in 65 and 22 offered the feedback for this international consensus. Well, I think that's a huge response, which I think is great. That's all right. So sorry to interrupt. Keep going. I want to hear more.
Yes. Thank you. Look, Elizabeth and Lauren and I agree with you. We thought it was a fabulous response from the IDs, and it certainly makes the IOG truly international and very rounded and very grounded in the content from that point of view. It also helped to sort of highlight, if you like, the differences in terms of countries and their health systems. It highlighted the advances in terms of commercially available appliances in many countries, and conversely, it also showed up those countries where they are less fortunate to than advanced healthcare systems, and are less able to provide evidence-based care because they do not have access to commercially available products. So it was very helpful from that point of view to be able to highlight some of those differences and also highlight some of the difficulties that stomal therapy nurses or ET nurses and clinicians have in being able to provide an appliance to contain the effluent from a stoma and prevent some of those peristomal skin complications from occurring. And as you just indicated, we had 22 responses from our IDs, and therefore not all of those people have English as their first language. And so sometimes there were some limitations in terms of translation and where we're interpreting the meaning of the text that was provided. And often that meant that we went back to the ID on several occasions to clarify what was being said to make sure that the content was correct.
Yeah, that seems like a lot of work. So thank you for doing that. Would you think that that was like one of your biggest barriers, or what were your like kind of barriers to this project? I mean, it seems like a huge undertaking.
It has been a 3 years journey, I will have to say. So the first edition was launched in 2014, and at that time we only had 9 recommendations and only 10 input from IDs. So it was a huge improvement with this new edition to get all these feedbacks and have this document, which from our point of view is much more inclusive than the previous one. So we have the first barrier is that the whole work has been done on a voluntary basis. We have received an educational grant received from the industry, and it was a lister, and we are grateful for lister for being supporting us on that. But the grant has limited us in the number of in-person meetings, and we just have 3 of them. But we were not influenced in any way regarding the industry by the methodology we have used or the content we have introduced in this AOG. We have also increased significantly the volume of literature we have reviewed in order to meet the AOG inclusion criteria. And of course, COVID-19 has not been helpful in the development of the AOG. As frontline clinician, the development of these guidelines priority have been changed due to the pandemic. The feedback received from peer reviews indicate changes in the volume of their work responsibility and also make it difficult to respond with content in accordance with originally timeline. But fortunately, with emails, Skype, and Zoom calls, we were able to complete the task. Hopefully here, technology have worked, even though it will take a longer time than we have expected to do the work. And as we said previously, the huge response we have given back by individuals and organizations, because we have had 104 individual peer reviews comments that we have included, and 22 organizations we were agreed to support our recommendations. That was really a huge things to see how we can implement these comments on the AOG to make it better. And obviously we cannot make all the changes they have asked for, but we keep in mind those suggestions so the next time we can take them from the start for the new edition of the AOG. And we are really grateful for all the valuable comments on that.
Yeah. I mean, I think this is such a great contribution for both hospitals or home care agencies, but for the patients, truly to just advocate for all the things that they really need, and to partner with industry and stuff to get those things. So, within the guidelines, so I'm just kind of going to give a brief overview. There's 4 true sections, and that's education and scope of practice, the holistic approach to care, the preoperative care needs, and then the postoperative care needs. And within those, you guys have done a great job of laying out each of your recommendations. So, because this is a bit of bite-sized education and giving people kind of just a taste of what the guidelines are, obviously you should read the entire article to understand the breadth of the work that you guys did. But if you had like just a few takeaways for, let's say, like a bedside nurse, what would you say were like those big takeaways for that bedside nurse? Obviously there's 15, but but if you can like just say like highlight kind of the higher level things.
Oh, I would like to start. And just to put this in perspective, the 15 recommendations were distilled from over 340 evidence-based articles that we read. So what you're asking is quite a task. But
oh, I know. I'm sorry.
But education makes a difference, okay? And that the takeaway that specialized education, which happens to be WCET's mission, really has a positive impact on the life of patients with ostomies. There are better outcomes postoperatively if the patient received education from a nurse who had specialized knowledge of ostomy care. And that, to me, and Laurent and Jenny, is why we spent so many hours volunteering to do this, because it really makes a difference for patients' lives.
Yeah, I mean, I think that's not just for the bedside nurse, that's for everybody, right? To really hear that message and echo it. Actually, this is probably more for administration to hear that, right? That a specialized nurse is worth their weight in gold to offer that for their patients. So does anybody else have any like words of wisdom or insight or kind of takeaway points that you want to discuss?
I think Liz, just to pick up on what everybody has been saying in terms of the role of the ETs, stoma nurse, ostomy nurse, and clinicians, that the IOG and the body of evidence certainly highlights the importance of being trained in ostomy care. It certainly enhances the significance of our specialty and how the ET or stoma nurse and clinicians can make a difference to not only the individual with a stoma, but also to their relatives, and how well they are able to adjust to living with a life with a stoma. It also provides, as you were saying, evidence to justify the role of the ET ostomy nurse in terms of screening for, preventing, and managing complications, which also reduces costs to hospitals, other health administrators, and health systems. And certainly, as we live in ever-increasing multicultural societies, where people have different backgrounds and different beliefs, as we were discussing earlier, it is important to be open-minded, and it is important for people to have the necessary skills to provide better stoma care to all people wherever they lived and irrespective of their cultures. And this, we believe, is highly critical to successful outcomes and people being able to get well, reintegrate themselves back into their family and society in general.
Laurent, maybe you could talk a little bit about our collaborative recommendation in terms of physicians and surgeons, as well as stoma-trained nurses, and the importance of stoma site marking and how that makes a difference, and why we have a recommendation about that.
That's for sure. The literature supports the training of physician and non-specialized nurses to do stoma care marking, but that needs also to be trained and to be learned, because site marking is important to be done, and preoperative care are crucial if they can be provided. individual person characteristic, location of the stoma, how the stoma is done, the surgical procedure which is made, or some of the factors who has a major impact of potential stoma and peristomal complication, and how well the person who lives with a stoma can adjust in a daily basis, dealing with their care and dealing with their stoma. And enhance surgery after enhance recovery after surgery. Programs or other clinical pathway that use an interdisciplinary approach to focus on preoperative care, fast-track patients toward early discharge to reduce complication, and longer state of hospital stay are advantageous, and they are prevent some complication by doing that. But at the same time, we are rush when people are in the hospital to do the maximum care we can do before they leaving home, and making the link between hospital and home care, and that's really important.
Yeah. Oh, there's so many really good pieces of information. So thank you guys so much for joining me today for our web and podcast. And I encourage our entire audience to check out the June 2021 issue of Advances in Skin and Wound Care to get the CEU for this article. I want to thank Advances and the APWCA for making this podcast possible. And I want to thank Elizabeth, Laurent, and Jenny for joining me today. Anything else you guys want to say before we say goodbye to our audience?
Yes, I'd like to say two things. First of all, as we found out with COVID, the same information gets translated differently in different countries. So one of the new things in the guideline, and Jenny may want to add to this, is that we have a section on how to implement the guideline, because the guideline, and you can by the way, you can download the 15 recommendations are available on the WCET website, and they are in several languages, just the statements. They are in English, French, Spanish, and Portuguese, and Chinese. Is that correct, Laurent? Since you keep. So the 15 statements are there for anybody to download. The full guideline, which is 400 pages, is available for purchase in English, and shortly will be available in Chinese.
Wonderful.
But more importantly is, if you like this podcast, which we hope you have, and if you like our article, which as a co-editor-in-chief of Advances in Skin and Wound Care, I hope you like our journal. You can join us next year in June of 2022 when WCET and WOCN are going to have an international joint conference in the USA, in Fort Worth, Texas. God willing that we can all be physically together, and you will see a global educational event in the United States. And there is just the synergy, which I know is an important word for APWCA. When you see the global congregation of people together collectively for education to better patient care, it's an amazing event. This is only the second time in the 40-year history of WCET that this is going to happen. So I really hope all of you will come.
I'm very excited. You will see me there for sure. All right, great. Well, thank you guys so much again. And we want to thank our audience for tuning in today. Don't forget to subscribe to the podcast series and check out the article. Thanks so much.
Thank you.
Thank you, Liz. Thank you, Elizabeth. Thank you, Laurent. Bye. Bye.
Have a safe day, everybody.